Chapter 12, Inventory Management. Establishing an inventory management system. Research and select the type of IMS that fits the needs of the dental practice. Discard or recycle obsolete and expired products. Create a database or list of inventory items. Establish maximum and minimum levels to create a baseline for reporting. And export the database into the new IMS. Key functions of an inventory management system: to track inventory supply, purchases, and usage, use data communication technology to transfer information such as barcoding, efficiently track items, use data communication, interference with vendor catalogs and point of sale options, provide information required by OSHA, store data on an individual computer, network server, or web based cloud hosting. Multi service inventory management software system. Inventory management maintains a complete and current list of all supplies and equipment, scans items in and out, tracks expiration dates, and alerts you when products should be reordered. With online purchasing, maintains a shopping list, orders products from multiple suppliers, and leverages comparison shopping, places order directly with individual suppliers. Multi-service inventory management software system, online purchasing track orders, manages back orders, financial reports and analysis, categorizes how much money is being spent, and then sets and tracks budgets. Data communication technology includes the barcode and radio frequent identification, and then manual management systems are effective but also time consuming and may use a simple index card system. Steps in determining when to reorder: determine the rate of use, determine the lead time, master lists of supplies, and categorization of supplies. Selecting an inventory manager characteristics: is organized, should have time to carry out these duties, can communicate with others, acts as a team member, and is a good shopper. The duties would include develop and maintain an accurate inventory system, seeks input from the rest of the dental healthcare team, monitors inventory, maintains an accurate and current database, processes the orders, receives the orders and verifies invoices, organizes and maintains storage areas, and tracks barcodes. Elements of a good inventory management system: qualified inventory manager in charge, supplies and products identified quickly, products stored appropriately, supplies easily accessed by dental and healthcare team, reorder points clearly identified, protocol clearly defined, and processes in place. Identify needed supplies and products, choose vendors to contact, develop ordering guidelines, establish a receiving protocol, organize the storage area, and check for OSHA compliance. Types of supplies, products, and equipment would include consumable, some including x-ray film, anesthetics, needles, and saliva ejectors; non-consumable, including our handpieces and instruments; and then major equipment, which may include dental chairs and radiology units. When selecting and ordering supplies and products, identify supplies and products to be used, research according to product type, attend trade shows and conventions, network, and visit with sales representatives. With major equipment, these are costly items. Considerations may be budget limitations, minimal functions, equipment features. And the vendor choice may include catalog or supply house. Types of dental suppliers could include Traditional full service companies, the one stop shop experience, direct sales company, online distributors, and group purchasing organizations. Information to consider before placing an order. What is the shelf life of the product? What are the storage requirements? Will technology change before the product is used? Has the product been tested in the office? Will information provided in printed material? What's the return policy? Is it economically advisable to invest in a large quantity order? Steps in accepting shipments include signing for the shipment, check that the correct items were shipped, inventory the contents of each box, and cross check against the shipping invoice. Check the invoice against the original order, file the shipping invoice, record any back ordered supplies, file any safety data sheets that are needed, enter the quantities of new supplies in the inventory control system, and place suppliers in the appropriate area. Occupational Safety and Health Administration mandates a protocol for alerting employees to health hazards and telling them proper ways to safely perform their duties. Employees must know which chemicals are hazardous, what risk is involved in working with some chemicals, how to use chemicals safely, how to handle chemicals safely, and where to find hazardous information. SDS sheets communicate product information provided by the manufacturer, usually with the product, and maintained in a notebook or an electronic format. All dental practices must follow a very specific infection prevention and control protocol. CDC also has published information, summaries, and reports to help the dental healthcare team better understand requirements for safe care in the dental setting. Key administrative recommendations for dental setting. Develop and maintain infection prevention and occupational health programs. Provide supplies necessary for adherence to standard precautions. Assign at least one individual trained in infection prevention and responsibility for coordinating the program. Develop and maintain written policies and procedures. Facility has system ready for detection management. Additional components could include infection prevention, education, and training, dental healthcare personnel safety, program evaluation, standard precautions, and dental unit water quality.